Welcome to Module 6, Labeling. In this module you will learn the different types of labels, label requirements, and common label symbols. Note that there will be a quiz at the end of this module. You must score at least an 80% to pass. The quiz can be retaken as many times as needed. Let's first start out with defining what a label is. The labeling requirement can be tied back to Clause 7.5.8 of ISO 13485, as well as FDA's 21 CFR 801. Medical device labeling is any information associated with the device targeted to the patient or user. Labeling is intended to help assure that the device is used safely and effectively, and informs the users about proper use, risks, and benefits of the device in the language that they can understand. Medical device labeling is supplied in many formats, including that of physical packaging and/or device labels, as well as IFUs or user manuals. Marketing promotional materials are also forms of labeling. This includes websites, pamphlets, patient brochures, posters, social media posts, blog posts, etc. This information must be approved and be truthful and not misleading. Evidence is needed to substantiate any claims to medical benefits in these labels, especially for higher risk devices. Let's now discuss labeling requirements. Labels should have a unique device identifier, or UDI. UDI means an identifier that adequately identifies a device through its distribution and use, meeting the requirements of Part 830.20. A unique device identifier is composed of a device identifier and a production identifier. A device identifier is a mandatory fixed portion of a UDI that identifies a specific version or model of a device and the labeler of that device. The production identifier is a conditional variable portion of the UDI that identifies one or more of the following when included on the label: the lot or batch number, the serial number, the expiration date, the manufacture date, and for tissue-based product, the distinct identification code. The device labeler must provide the UDI in two forms on labels and packages. This includes easily readable or human-readable plain text, as well as machine-readable forms that uses automatic identification and data capture technology, or AIDC technology. AIDC is any technology that conveys the device identifier in a form that can be entered into an electronic patient record or other computer systems by an automated process. This is like a barcode. The device labeler must also present dates on the device labels and packages in a standard format that is consistent with international practices and standards. This includes 4 digits for the year, 2 digits for the month, and 2 digits for the date. Device labelers are also required to submit information to the FDA-administered Global Unique Device Identification Database, or the GUDID. GUDID includes a standard of set basic identifying elements for each device with a UDI and contains only the device identifier, which serves as the key to obtain device information in the database. GUDID does not include the production identifier. To submit information to the GUDID, the device labeler must first request a GUDID account. To request an account, labelers must submit a new GUDID account inquiry and then complete the associated new account request form. A device identifier shall be used to identify only one version or model. Whenever a new device package is created, a new device identifier for that new package should be assigned. When a change results in a new version or model, a new device identifier for that new version or model must be assigned. Relabeled devices must be assigned a new device identifier as well, with record relating the new identifier to the old one. Generally, medical devices require IFUs. However, an IFU may not be needed or may be abbreviated for devices if they can be used safely and as intended without instruction. EUMDR also has included new labeling requirements. Information pertaining to the identification of a device, its manufacturer, relevant safety and performance information should be accompanied on the device. These aspects may appear on the device, the packaging, or in the IFU. Additionally, manufacturer's current website information must also be made available. Per the FDA, labels must be designed and applied to devices or containers so that they will remain in place and legible during distribution, storage, and use. Upon receipt, packaging and labeling materials should be inspected and acceptance activities performed to ensure that they meet specifications. This includes the contents of the labels, such as any control numbers or expiration dates used. Control numbers are used for implant devices or devices that are used to support or sustain life and are used for traceability purposes. If used, expiration dates must reflect the time after final packaging during which the device is fit for its intended use when stored and used per its labeling. The manufacturer should have stability test data that establishes the intervals for which the device remains fit for use. Only when labels are approved can they be placed into inventory for production. Labeling and packaging operations and storage should be performed in a way that prevents mix-ups, such as using physical or spatial segregation when applicable. Because labeling is part of the DHF, any changes to labels must be reviewed and approved by the change control system. When making changes to the aspects of a device, a review to see if any labeling materials are impacted must be performed. Some key information that manufacturers should include on their medical devices are the following: the name and trade name of the device, the manufacturer date, indication that the device is a medical device, details necessary for a user to identify the contents of the packaging and its intended purposes, information for the licensed EU representative in the case that the medical device manufacturer is based outside of the EU, yet sells the device in the EU, the time limit for using the device or an implanting device that should be expressed in terms of the year and the month, warnings or precautions that need to be brought to the immediate attention of the user, the IFU, EIFU, and web address, the serial number and lot number, and a UDI carrier. For sterile devices, labels should explicitly state the requirements for the sterile barrier labeling. This information includes identification of the sterile barrier, declaration of the sterile condition, sterilization method, manufacture date, expiration date, and direction to check the IFU if the package appears to be damaged. Labels also require the use of different symbols. A list of these symbols and their meanings are defined in ISO 15233-1. Common symbols include serial number, lot, manufacturer, date of manufacturer, used by, sterile, single use, caution, consult IFU, etc. Additionally, IEC 60601-1 also has label requirements listed in Clause 7 and Annex C. This requires both internal and external markings be clearly legible and that all external markings are durable. This is mainly for electronic devices. We have now reached the end of this module. Be sure to review all applicable procedure-informed templates that Rook has related to the requirements listed in this module. When preparing documents using our templates for clients, be sure to customize them to what the organization actually engages in for the products they make. Before moving on to the next module, take the Module 6 quiz. You must score at least an 80% to pass, and the quiz can be retaken as many times as needed.